Coronavirus vaccine developers are making major strides in pediatric trials. Pfizer announced Monday it is transitioning into phase 2 of its trial in kids. It will now be testing its drug on a larger group of children under the age of 12. Moderna's CEO says its vaccine could be available to this group by early fall. The company says it's slowly and carefully testing the vaccine on younger ages. Meanwhile, Dr. Anthony Fauci says the variant first found in India now accounts for 6% of U.S. cases. He said the dangerous strain is a, quote, powerful argument for Americans to get fully vaccinated. Nikki Battiste reports from New York City.
Tonight, new concern about the dangerous Delta variant. Dr. Fauci is urging more young people to get vaccinated before the variant first detected in India becomes dominant in the U.S., warning it's already taking over in the U.K., where transmission is peaking in 12 to 20-year-olds. 1/4 of 12 to 17-year-old children in the U.S. have received at least one vaccine dose. President Biden tweeting today, if you're young and haven't gotten your shot yet, it really is time. It's the best way to protect yourself and those you love. Today, in an effort to get more people vaccinated, Moderna announced its vaccine will likely be available for kids as young as 6 months. And Pfizer told CBS News its next phase in the trial for children as young as 6 months old should begin in the coming weeks.
What's the number one question you get from parents? Is it safe to give my child the vaccine? The vaccine has been proven safe. I think an mRNA vaccine is actually safer than a traditional vaccine. There's really no side effect, only, sleepiness, sore arm, and a little fever.
Dr. Hess says one side effect from the pandemic is children aren't getting sick with common illness. Experts say it's because of increased hand washing and mask wearing.
During the COVID pandemic, we really did not see any sick children. We didn't see ear infections. We didn't see flu, RSV.
But Dr. Hess says kids need to build up their immune system.
I never had so many sick kids in my office as I did in the last 3 weeks because they have been in a bubble. They need to be exposed to the other viruses to build up their own innate immunity.
Pfizer says it hopes to seek emergency use authorization for its COVID vaccine for children ages 5 to 11 as early as September, which means kids could be vaccinated soon after the school year begins. Elaine?
Nikki Battiste, thank you. Dr. Taison Bell joins me now. He's a critical care and infectious disease physician and the medical ICU director at the University of Virginia. Dr. Bell, welcome. The CDC estimates 2 states and 3 U.S. territories have a greater than 75% chance of seeing an increase in deaths over the next 2 weeks. Why is that?
You notice the overall global forecast for the country was for case and hospitalizations to go down. And so what that lets us know is that states that in particular have lower rates of vaccination will be particularly vulnerable and high risk when we get into summer months when people are more out and about. And you combine that with folks who are not as protected and not as vaccinated as other populations, and we have a setup for a rise in summer cases just like we saw last year.
Well, new data from the American Academy of Pediatrics shows the U.S. reported more than 16,000 new child COVID cases last week. That's the lowest number seen since June of 2020. But most children have not been vaccinated yet. What's behind this decline?
Well, one of the things that we have learned about COVID-19 in children is that it is less likely for children to transmit to each other. The more likely pathway of transmission is actually adult to child and adult to adult in the school setting, for instance. So what that means is if we have adults around children that are vaccinated, we've actually seen that when you vaccinate adults, you have less cases in children. So I think this probably reflects the vaccination effort. And to think about one of the great ways to protect children, particularly if we're waiting for younger children to be eligible, is to make sure that adults around them are vaccinated and protected as well.
That's a really important point. Well, an FDA advisory panel is expected to meet this Thursday to discuss coronavirus vaccines for kids. The agency previously told CBS News it will not discuss, quote, any specific products. What might come of this meeting, and do we have an update on when a vaccine may be available for younger children?
Good question. So I took a look at the agenda just to make sure I knew what they were covering, and it looks like it's more of a general meeting to discuss things like the epidemiological impact of COVID-19 in children, the operational aspect of a vaccine rollout and post-vaccine monitoring, what the criteria will be for meeting that bar for emergency use authorization for vaccination in children under the age of 12. So I think it'll kind of set the stage for the conversation around emergency use authorization that we can anticipate around the early fall, according to what Pfizer and Moderna have indicated when they will be seeking that authorization.
Well, the variant first discovered in India is now the dominant strain in the UK.
Yeah.
Dr. Anthony Fauci says we can't, quote, let that happen in the US. Is this variant more dangerous than others?
I do think that there's more concern about this variant, and I agree that this should be a reason to try to get vaccinated or those around you vaccinated, if not so already. And that's really because it combines a couple of aspects of variants before that we don't like to see. So, for example, with the UK variant, now the Alpha variant, we saw that variant was more transmissible or more easily spread, but it did not really have an ability to evade the immune response. So vaccinations were still very effective. Now, with the Beta variant or the South Africa variant, we saw that it did have that ability to potentially escape immune response. It was still effective, but it did cut down on that effectiveness, but did not have that increased transmissibility. The problem with the Delta variant is that it actually combines both the ability to be more transmissible and that ability to potentially evade the immune response. We saw, for instance, with the Pfizer data, that one shot of the vaccine was a little bit less effective than we saw with the earlier or wild type of virus in the 30s. That second dose does get you to a good range of 88%, but it emphasizes that we do need to make sure that we continue to push hard to try to vaccinate as many people as possible.
Well, the head of the World Health Organization is warning of a, quote, two-track pandemic. That means wealthier nations with higher vaccination rates lift restrictions while other countries suffer. He's now urging vaccine makers to donate half of their doses to COVAX. Dr. Bell, what's your take on this?
I think that we have to really pay attention to what's going on globally. It certainly does not mean that we shouldn't take off the pressure when it comes to trying to vaccinate our population. But when you see statistics like 44% of vaccine doses have gone to richer countries versus 0.4% to poorer countries, we see that there is this two-track and two-tier sort of way that we're handling the pandemic. We also know that the coronavirus takes advantage of any weakness that you have in the armor, and it has the ability to eventually spread to other areas. So if we have countries that have low vaccination rates and are setups for increasing cases, we have a higher chance of having variants, and maybe down the road there'll be that variant that might escape the vaccines and put us back to square one. So it really is important that we make sure that we dedicate plenty of resources, lots of vaccine education efforts, and logistics and coordination to make sure that we can get the countries that have been behind and falling behind because the gap is growing. We really need to catch them up for everyone's benefit.
All right, Dr. Taison Bell for us. Doctor, thanks very much for sharing your expertise with us.
Thank you.